Thanks, Michelle, for meeting with me today. I really appreciate it.
Oh, Ellen, it's my pleasure. I'm really glad you're here.
So you mentioned that there are several steps involved in getting the equipment. Can you tell me what those steps are?
First of all, planning is really important. And planning ahead is important as well, because getting this equipment, especially as it gets more complex, getting a cane, a walker, what we might call like a lower end or more simple piece of equipment can be very quick. But getting something that's individually customized for you as a piece of mobility equipment is a very involved process, and it can take longer. So the first step is to have you do an evaluation with a therapist and the wheelchair provider and a neurologist or the provider. So sometimes at a multidisciplinary clinic that ALS Association can connect you with, you have everybody there in one place, which is a real benefit to a multidisciplinary clinic. If you don't have access to that, these evaluations may be done in pieces. So typically you're going to have your physician, and then you'll have your therapist, either a physical or occupational therapist, that will do a therapy eval assessment. So they're going to do strength, mobility testing. They're going to be talking about what their needs, and they're the ones that really are justifying what level of equipment you need, why you need that level of equipment. They're identifying the specifics behind what kind of equipment that you're going to get. So you have the initial evaluation, you have the therapy evaluation, then from there, the wheelchair provider will put the specs together, and they'll get the quotes from manufacturers. They'll make sure that we have everything line itemed and detailed as to what you need. Then we'll need to get signatures from your physician on that documentation. So evaluation, the documentation, and then we go to funding. So then once we have the packet with all the detailed information for documenting why the equipment is important for you and a medical need, then we can send that packet off to your insurance company, and they'll review it for predetermination or pre-authorization. Once we identify from them what they'll pay for, the provider will share that with you, and then you'll be able to understand what is the insurance company paying for and what are they not paying for. So you may have, for example, a power wheelchair that has many different components on it, a cushion, a headrest, maybe some lateral supports possibly, and then some people will have a tilt, like we talked about, a recline for positioning, and they may also have a seat elevator that will help you get up to higher levels to reach into your cabinets. With all of those components, the insurance company will review everything, and then they'll identify and share with the provider what they will pay for. Once we get that determination, we'll have a conversation. The provider will have a conversation with you and say, this is what insurance covers, this is what would be required for you to pay for the equipment, and are you ready to move forward with that? Are you okay with the copay, basically?
Okay.
Once you say that you're okay with the copay, then we can pursue or order the equipment and get it in. Once we order it, it's typically 2 to 3 weeks. A lot of the process is getting that therapy eval, getting the documentation for the notes, doing the funding review, and then by the time we order it, we get it in, we're going to fit it to you, make sure it works, make sure that you know how to use it, give you all the instruction you need, because it is, well, it can be, I should say, pretty high tech, and we want to make sure that you're comfortable and safe.
My neighbor has a wheelchair that her mother used. Would that be something that I could use as well?
It's really important, Ellen, that people with ALS, that they really work through their clinical team to identify what's the best fit for them. It can actually be unsafe and ineffective if you're utilizing someone's piece of equipment that is, if you get it from a friend, or maybe sometimes people think, well, they go out on the internet and they see something, they want to just buy that. It may not be the best idea, honestly, because what can happen is it can be very unsafe and very, like I say, may not just work well for you and fit your needs. With your particular needs, everybody's a little different, but people with ALS and the clinical community, that is supporting people with ALS, they really understand the progression of the disease, and they understand the safety concerns and the safety needs. And more than that, like how to help you be like live full out in your life. Like how important is it, for you to spend time with your family or getting out into the community? We want to make sure that you have some mobility equipment that provides you all the support you need, but also has that safety factor. And really the only way to assure that is going to be to go through a clinic that that specializes in that.
Okay.
And
So they
yeah.
would customize it to my needs.
Yes, and they
Okay.
would customize it to your needs, meaning that if you're in a wheelchair, for example, that's 4 or 5 inches wider than your hips, or the depth of the seat is longer than you need and it's pulling you out, it's going to be unsafe for you. So that's what I mean by when I say that it's unsafe, that those are the kinds of things that can be an issue. And so when you're in a clinic and you get fit for your own wheelchair, you're going to get measured. We're going to talk to you about what are your functional goals, what are your needs, what are your interests. We're going to talk to you about your home situation. We're going to talk to you about transportation. We're going to talk to you about what's important to you in your life. And then we're going to work with the therapist, the physician, your caregivers, your important people in your life to come together with a solution that's going to work for you. So it's very custom fit for you. Whether that's giving you support for your upper body so that you feel secure, a cushion that has pressure management, because as you sit in a wheelchair for a longer amount of time, you're going to want to have a cushion that's comfortable and provides you good pressure relief so you can sit longer in your chair. Other things to think about as we customize the wheelchair, we're going to be looking at the how do you drive the chair. Some people are right-handed, some people are left-handed, some people are unable to use their hands. And we have power mobility adaptations that we can utilize if somebody can only use their foot to drive, or they're not able to drive with their hands or their feet. We have an eye gaze system that they can drive with.
What about the cost involved in paying for some of these, some of the equipment that I need?
Yeah. Yeah.
Is that something that's covered by insurance?
So Medicare will typically pay 80% of mobility equipment, and if you have a secondary insurance, it can pick up the rest. So we work very hard to help you find resources to make sure that you can get the equipment covered. One of the things to note, though, Ellen, is you had asked about your friend, and your friend has a wheelchair that, hey, would it be a good idea for you to just, use their wheelchair? One of the things to think about, if you are using a wheelchair that was given to you or donated to you, or that you bought off the internet, for example, and insurance doesn't pay for the chair itself, insurance will typically not pay for the modifications or repairs to equipment that they did not pay for. So it's really important for you to utilize the insurance and understand their rules, and we can help you. The equipment can take a while, so it is important to plan ahead like we talked about. It can take anywhere from, depending on the piece of equipment, it can take anywhere from 60 to 90 to 120 days to get the equipment, from the time you do your evaluation to the time that you're in your own wheelchair, depending on the complexity of the chair. There's many steps that go into place. We do, as providers, try to make that go through as quickly and efficiently as possible through the system, and insurance companies really do understand the ALS diagnosis, and they're also our partners in trying to get you your needed equipment as quickly as possible as well.
As the ALS progresses, so would I be able to get additional modifications to the chair if I need something different later on?
Yeah.
Or do I have to get a new chair?
The wheelchair will accommodate modifications, so you won't need to buy a new wheelchair. That's our focus as a provider, to make sure you have the right chair that will grow with your needs.
Okay.
And then we submit them to the insurance company, and it's a similar process as I described for a new wheelchair. Mm-hmm. So again, it's something that we want to plan ahead for. You start noticing things are changing. You start feeling like you're weaker. You start feeling like you need more support. You don't have quite what you need. That's the time to reach back out to the provider the wheelchair provider and or the ALS Association and just say things are just not working quite the way I need them to work, and then we will help you get what you need.
Now, I know I would not be able to do this myself. So is there somebody that I could contact that would help me navigate this whole process?
Yes, it can get a little daunting and a little confusing at times, so understand how important it is. We are here for you. You have a team of experts around you, okay, and we're here for you. As a wheelchair provider, we're going to help navigate that whole process from eval to delivery and beyond with modifications and repairs and whatever you need for your equipment. For people to find a wheelchair provider in their area, the best thing to do is to work with ALS Association. ALS Association has connections with providers that they trust and are comfortable with. And when you do choose your wheelchair provider, that you find a provider that really understands ALS and the disease process and that they understand how to accommodate your needs with the equipment.
Thank you so much for meeting with me today and for sharing the information that you did. It's just was very informative and I really appreciate it.
Thank you, Ellen. I really appreciate you being here today, and you asked a lot of great questions. I'm sure they'll help a lot of people. Thank you.